introduce the panel. I invite Dr. Musa Dawood, President, Jordan Anti-Drug Society and Jordan Green Crescent. Green Crescent, please. Doctor, come on. I also invite Dr. Sandeep Bhola, Nodal Officer, Navajeevan Kendra, Punjab. I invite Rishi Ojha, President, Just Say No, Nepal. So the panelists, creating drug-free societies. So there's been a lot of discussions around drug-free societies. So we're going to discuss whether is this an utopian concept? Is this possible? Can we actually dream of drug-free society? So we're going to explore these possibilities. And I invite Dr. Musa Dawood to make his presentation. Can I just roughly introduce you to the audience? Dr. Musa is responsible for local and regional international prevention programs in MENA. He is also senior expert in non-governmental affairs and has conducted his own studies about challenges and opportunities. He used to manage pharmaceutical companies in the Gulf states areas, and also Dr. Musa was nominated in the Jordan Parliament in 2016. He is managing Green Crescent MENA Rehabilitation Center project for future recovery of the people in the region. There is much more to him, but because of the short of time, I don't want to go into all that. But please, Doctor.
Thank you. Good morning, everybody. Thank you for this introduction about me. You did a good search, so thank you. I appreciate that. I would like to thank all of you for being here today. And the good thing that I will be the first speaker in the panel, which is my honor, so thanks a lot. Today, we are going to talk about a drug-free community. And drug-free community need all of us to work hard to reach this dream. As you said, it's a dream. Is it achievable dream or not? What do you think? Is it achievable dream to have a drug-free community? Very optimistic. Very good. To reach that, we need some stages and steps. And the main step is for the civil societies. These non-government organization is the crucial point to reach such a dream. And to do that, we have a lot of challenges. Today, we are going to talk about these challenges, but we need to know what's the NGO positioning. The civil society, where supposed to be. The problem with the understanding of the civil society, especially the volunteers, that they misunderstand where the NGO is supposed to be working. Is it close to the community or closer to the government sectors? Where exactly the civil society is supposed to be? And also, what's the challenges they might face during their missions? And how we can deliver and divert these challenges into opportunities? And how we can reach the capacity building program. Then, so going briefly about these points, I would like to tell you that community and NGO are apart, but we belong to the community, wherever we work with the government or either we work with the civil society. But the NGO is the link between the community and the government sectors. It's very bad that some civil societies are very close to the community and population, far from the government. And also the worst thing is to be close to the government. So the civil society became a part of the government movement. NGO is a non-government, so it's supposed to be the link and the bridge between the community and the government itself. When we reach this position, then we can start dreaming about our dream to achieve our mission. But during this way, we might facing some challenges. I will go through some of them. The poor cooperation with the mass media. This is one of the main challenges the civil society might face during their mission. Why? Because those civil society, and I know most of you are working with some civil society and you might face these challenges. So being apart from the cooperation with the mass media might affect your work and also your future work. Also, the lack of commitments. Most of the civil society, they start at the beginning with a very powerful commitment, then gradually they going down until they lost the hope. Lack of the feedback and social support, and that will affect also how the attitude of the volunteers who are working with the civil society. Unwillingness to cooperate with each other. And this challenge is very obvious, especially with the new civil society, who started working and dreaming to have the best position for their civil society, and then they start competing each other in a negative way, which make them unable to work with each other. And also the politicizing the NGO, especially in our region. NGOs start getting support from different parties, political parties, then these political parties will influence the NGO. So the NGO lost his way and lost his campus. Lack of a professional experience of working in narcotics, especially in our area. Those people who work with the civil society, they would like to serve the community, but they don't have enough professional experience. So what they need training. Training need fund. Fund might affect their campus because they need a support and funding. The funding come from either business sector, which will lead them also to have their influence, or political parties, which also can change the campus of the civil society. Fear of grants and international cooperation. It's not common in all civil society, but that fear might affect also the influence and the performance for the civil societies. But how we can divert these challenges to opportunities? But let me mention some of these opportunities, especially when we study the civil society future. During the next 10 years, we can increase the self-help groups and green groups, advocacy and public education groups, group with major work so we can have some mass work, capacity and mobilize community resources, which can be done with the networking and the expert groups in the world. NGO staff team growing in capacity and willingness beside skills that will be very easy if we have reaching the capacity building program, which is my recommendation here, is to have a lot of capacity building program for the local civil society. These organizations, they need these capacity building programs in local basis, regional and international. So I would like to have this recommendation to be added to the recommendation of the forum, having a capacity building programs in different region, in local, regional and international work. Thank you so much for your good listening. Hope that we will reach the goals of this forum at the end of the forum. Thank you so much.
Thank you, Dr. Mosa Dawood. Let's take a seat. That comes from an organization with 100 years of experience. So we will definitely take these recommendations. And I will now invite Dr. Sandeep Bhola, Nodal Officer, Navajivan Kendra, Punjab. In 2007, Dr. Sandeep started Navajiva Kendra, a specialized de-addiction center, first of its kind in the state. It was a unique, coordinated initiative of District Administration, Health Department, and District Red Cross Society, and has been running successfully as a role model. In 2012, India's first methadone clinic was launched in Kapurthala by UNODC and AIMS. In 2016, Navajivan Kendra was conferred the Best Non-Profit Institution Award by the President of India. And in 2007, an exclusive women de-addiction center was started. And in 2019, a pilot project on comprehensive health and rights-based approach for women who use drugs was rolled out. Besides these, Dr. Bhola has been working as a technical expert for NABH towards accreditation of opioid substitution therapy and integrated rehabilitation center for addicts. He has been chosen by the International Society of Substance Use Professionals for the coveted International Award for the Excellence in the Field of Drug De-Addiction. Over to you, Doctor.
Good morning, and thank you so much for such nice words. Very encouraging also. Drug-free society, very optimistic and very challenging quote, I would say. In this, we won't be able to achieve the goal until and unless we have reached up to the hidden population. And what are the challenges to bring out the hidden population? I would like to discuss on that. What is meant by the hidden population? It is the population which has never been able to reach to our services, whatever we have been providing, or to the population to whom we have not been able to approach with our services. In September 2018, there was an article in a leading newspaper, Punjab's New Addicts. I was very surprised to see that because in 2017 we had started that women de-addiction program. And in 18, I was reading that new addicts in Punjab. Is it really the new addicts or that we have started thinking on these lines just now? That was the question. And I went through the international literature, the Indian literature, and the local scenario. International literature, 2019, states that 19.5 million females, that is 15.4%, between the ages of 18 or older, have used illicit drug in the past 1 year. The illicit refers to the use of drugs including marijuana according to the federal law and misuse of any prescription medications. And 8.4 million females, that is 6.6%, ages 18 and older, have misused prescription drugs in the past 1 year. And these are huge figures for the hidden population. Some Indian studies have been conducted from 2003 and 2004 to 2013. Many studies have been conducted, none for the females exclusively. And most of these studies have quoted that there is 2 to 3% of the female population, this sample which has been taken, has been using some kind of drugs in the past. A survey was conducted in Punjab, the state to which I belong, Punjab Opiate Dependence Survey. The people who conducted the survey, all the institutions are sitting here in the hall. It was conducted by Society for Promotion of Youth and Masses, SPYM, All India Institute of Medical Sciences, Delhi, and Ministry of Social Justice and Empowerment. In 2013, the study was published in 2015. what the inference they got out from the study, that 1% of the total population, the drug-using population, opioid users, have been females. So that point has been clicked, and that point was well taken up by the government organizations and government. And interestingly, the study which has been conducted, this POD study, it was conducted to estimate the size of opioid users only. No other drug has been, no alcohol or cannabis or any other prescription drugs have been taken into consideration. And these data has been collected from the indoor facilities. In the past 1 year, whatever the clients have been admitted in those centers, they were taken as seeds, and from them, their peers have been contacted, and this way the data has been collected. And during that period of time, there were no indoor facilities for females, and very few OPD-based facilities were available. There were some barriers to access why this hidden population, or especially the women population, why don't they approach the services we have been providing. One is that lack of decision-making power, lack of knowledge among professionals and treatment seekers also. Yesterday only I had to refuse admission to one female who was 2 months pregnant, because I was not very sure that how to start the treatment in such a case. So I had to refer it to a gynecologist to get the clearance done from the gynecologist that we can start some kind of medication to treat her heroin use. Lack of appropriate gender-responsive and low-cost evidence-based treatment models. Structural barriers are there: childcare, lack of services for pregnant women, location and cost of treatment, lack of women-only patient care for de-addiction, lack of physical safety at treatment centers, lack of harm reduction programs, lack of information and treatment options. There are social, cultural, and personal barriers also: stigma, shame, and guilt, fear of losing custody of children, lack of support from family, particularly husband, partner, or significant males. And interestingly, many times, if the couple, husband and wife, and both are using some kind of drugs, they come to us that even then the husband is not very cooperative to get the treatment of his wife done. Substance use as a solution rather than a problem, lack of confidence in effectiveness of the treatment. These were some of the barriers we could find out that why the women, or what we call the hidden population, doesn't approach us. Other points: physiological and psychological features that need to remember, that women face unique issues. Sex, the differences based on their biology, and gender differences based on their culturally defined roles. Women often use substances differently from men, that they get addicted to any substance within a lesser time. Researchers have found that differences in how men and women use substances and react. For example, a smaller amount of substance, they can experience the effect more strongly. The women feel the effect more strongly. Women can respond to the substance differently, that they feel the more cravings and more chances of relapses are there. Sex hormones can make women more sensitive than men. Women drug use make them more, they affect more on the blood vessels and heart of a female. There are more chances of women dying from overdose than in comparison to males. And in the past, women had not been included much in the clinical research. Keeping these things in mind, in 2017, with the help of state government and with the help of district administration and district Red Cross Society, we started an exclusive de-addiction program, indoor program for women. We named it Nav Kiran Kendra, a new ray of life. It is a government-funded and government-supported indoor facility exclusively for females. Supported by District Administration, Health Department, and District Red Cross Society. It is a totally separate unit within the hospital, free of cost for the clients. With the all female staff members in place, all the premises is under CCTV surveillance. We have started vocational courses, a few vocational courses for the women in this very center. And we have recently, with our experience, we have started to allow the women to keep their younger children, about 4 to 5 years. If nobody's there to take care of them at home, we allow them to keep the children with them. And it has been named as Her Home Without Drugs. This is, there are a few pictures of our center and the staff we have. And recently, we have started another pilot project, which is comprehensive health and rights-based approach for women who use drugs. This program has been started to look into to draft a policy for 7 countries, namely Thailand, Vietnam, Cambodia, Nepal, Philippines, Indonesia, and India, to draft a policy for women drug users, what kind of package that must be available for them so that they can approach the services easily, they can avail the services easily. Because it's not only the drug use that matters in such cases, it's their gynecological status, the gynae checkup, their HIV, HCV, hepatitis B, tuberculosis status that also matters, and treatment of that is also required. And along with that, linking them to the social security schemes provided by the government or through NGOs, whatever is available, linking them with that is the aim of this project. And recently, we have held a national level consultation workshop in which 30 female drug users from all over the country have participated and they have shared their experiences, what kind of problems they have faced. And that is another chapter we have added to in drafting this policy, because that is coming from the clients themselves, what kind of challenges they are facing. It's not about the challenges we are facing, it's also about the challenges they are facing to avail the services. So friends, the message is very loud and clear that establishing exclusive treatment facilities for women and all the other hidden populations, be it children, be it LGBT community, be it any kind of people who have not approached us or to whom we have not approached, besides crackdown on availability of drugs, are necessary to address the problem and the goal we want to achieve, or wish to achieve, the drug-free society. Thank you so much.
Thank you, Dr. Sandeep. Especially, these are definitive steps towards drug-free society, and the region, Asian region, have very similar socio-cultural roles defined for women. So to break these barriers, it is imperative that exclusive centers for women open up. And it is especially interesting in the context of Project Venda as well, because like Punjab, we are following suit in case of the menace. Kerala is supposed to be number 2. And our crisis is among the children. And to date, we don't have an exclusive center to help rehab children, or exclusive child-friendly center for rehabilitation of children or young adults. And they're just grouped with the elders, and that doesn't work. So these things are, we have to bring it up front and discuss and ideate. And I go on to our next speaker, Mr. Rishi Ojha, President, Just Say No, Nepal. Please take the dais, sir. Rishi Raj is a member of the WFAD and New York NGO Committee on Drugs. He is also a member of Ministry of Home Affairs, Narcotic Control, and advisory member for the high-level committees for AIDS, TB, and malaria, Ministry of Health and Population, Government of Nepal. He has been working on comprehensive package of drug and HIV/AIDS service in prison settings under FPAN and Government of Nepal and UNODC, ROSA. Rishi holds an advanced diploma in the prevention and management of drug and alcohol abuse from the Tokyo Metropolitan Government campus. Thank you.
Thank you, Chairman. I am grassroots level social worker. First of all, thank you for our President, World Federation Against Drugs, and also in the Regina, where several times we are email corresponding and so many times. Then also in the Fourth Wave Foundation, especially in the Venda. Here is the so many expert, researcher, and NGO leader, and also in here is the government leader. They are working several things, several places, national, international conference they are organizing. But I am only for sharing about what we are doing in Nepal, what we do in Nepal, what you need for Nepal. Only for that issue I am going to explain it here, because I am not going to talk about everything about the drug issue. Everybody know in the drug issue in society. Children's, youth, adolescent, and everybody know. But what is our responsibility in the country? What do you need in the country for the international supporters and as a technical also as well as a development country as a financial support? That is my issue. I think this slogan is already yesterday. Mention is there is the Kofi Annan and 2060. I don't want to deliberate and speech and this slogan. Yesterday my one colleague already delivered in this speech. Drugs are the part of the human society. Culturally and historically, Nepal is not acceptable. Exception. The government Nepalese will not allow any illegal drugs. The current Nepalese policy will not achieve the goal of a drug-free society. I'm not going to read all the things, but we have to go into point out because of the time limitation of the times. We are not drug offenses committed to Nepal are illegal production, sale and distribution, export and import of drugs, storage and consumption of the drug and chemicals. In Nepal, there are topography, environmental, degradation, poverty, and economic migration all are linkage for the drug, and they combine with over the factor of the increased vulnerability of the drug abuse, driving in HIV infections also. One is the survey in the hard drug users in Nepal, and previous 2006, there is that time is the 46,310 people are hard drug user. Similarly, in the 2012, in the drug survey report, there is the 91,532 people are the hard drug users. This is the below 20 years. Youth are the vulnerability, and they are affected by the drug use. We are also say something in here about the children also in the alcohol and drug abuse. In 2002 is the one survey, and 180 children above then, 40% of the such girls are ever taken overall drugs and alcohol. Above them, the 20% are the most commonly used drugs in cannabis, and followed by the inhalants, tranquilizer, and opiate drugs. This is also in the one of the major problem in our children. Other side is we are working also in the prison setting program in Nepal, especially in after the federalism in our country. Previously, you have the 75 districts, now is the 77 districts. Above them, there is 73 prisons in our country and 7 provinces. Near about 21,000 prisoners are in all over the country. Prison come under the control of Ministry of Home Affairs and the Prison Management Department. More than 40% prisoners are the Nepalese prison are the drug-related offenses. The major drug problem are present are drug dependence, but very difficult to, in Nepal, there is no any treatment and rehabilitation program inside the prisons. Although also there is no any psychosocial counseling program in Nepal. There is a very crucial issue in the prisons, inside the prison in Nepal. And drug situation in Nepal. Cannabis has been used traditionally in Nepal for centuries. It can be found growing while the high hills of the central mid, west and far western part of the Nepal, where craft eradication is very difficult and very expensive of this issue. The recent year carried out by eradication of the campaign by police, but very difficult. Manufacturers. Nepal does not manufacture heroin, but produce illegal high-quality cannabis grains. Its illegal drug requirements are met through imports. Nepal does not produce any of the precursor. We are also in the 1988 UN Convention, we are going to follow up of this issue. Trafficking. Illegally cannabis produced Nepal is processed into hashish, cannabis, heroin, which is routinely smuggled into in our border is very open. Then India, state of the Uttar Pradesh and Bihar, from there are find its way to 3 drugs situation in 90, Delhi and Mumbai, NCB already reported. And NCB 2001 and 2002 already, NCB already reported all the out. Then other thing is the our Tribhuvan International Airport is the also transit point. The recent year there has been evidence of the Tribhuvan International Airport. Kathmandu is being used for the transshipment of the drug, mainly heroin and cannabis. Policy on illegal drug in Nepal. What is the policy in our government? There is the one high-level committee under the ministry, Home Minister. The different ministry is also in the member of this committee, also as well as civil society. Similarly, one is the other executive committee in our country, the chair by the Home Secretary. Also there is incorporate in the civil society people also in the participant in this committee. We have very long, 1976, we have the act still existing in the Narcotic Control Act. But this Narcotic Control Act is also, they are not going to excuse of the drug users for the treatment. Now policy is going to revise in now recently. We have going to policy is going to revise. The revision of the policy and the also Narcotic Control Act, where the fighting of the government also, and sometime in the negotiation for the right of the health for the drug users, then now is in processing in our parliament. Maybe the next parliament going to endorse by this Narcotic Control Act, then easy for work in Nepal also. Furthermore, Ministry of Home has also initiated the National Drug Prevention Policy. Very difficult to convince of the government to prevent, because our country is the lot of resources for the harm reductions. Needle exchange programs, OST program, methadone and buprenorphine program, but prevention program there is no going to support in Nepal. That is the difficult. Global Fund also going to support in Nepal in the harm reduction programs. Also, PEPFAR is going to, now is the 2 years program, just like the minimum $10 million they are going to expend in the PEPFAR, President Fund. But there is the very difficult for the prevention programs. Only for the risk reduction, name of the harm reductions. There is no any prevention program in Nepal. But this prevention policy is the very difficult to raise the voice of the Minister for Home Affairs and Secretary. Then they are realization of the prevention policy in this year. Maybe coming parliament going to endorse by also the prevention policy. Here is also in the our alcohol policy in Nepal. There is the, I think, our children organization, very good leading in the alcohol policy in the CIVIN. They are leading of these organizations of the National Regulation and Control Alcohol Policy in the 2017, already endorsed by the Ministry of Health and Population. But still now they are not going to amend it. We are sending in the cabinet, but cabinet written by the Finance Ministry. Cause of the taxation and so many things for the alcohol policy amendment. Then maybe the next parliament going to endorse by the alcohol policy also. Tobacco product. Tobacco is our policy and our act is the very strong, but implementation is very difficult. To take a legal provision to reduce control and regulation, the import, production, sales, and distribution and consumption of the tobacco products. Already 2011, we have act, but very difficult to our developing country, grassroots level and village area to have difficult for the sensitization awareness about this issue, the implementation of this law. And what we are doing in activity for drug-free society in Nepal. One is the prevention campaign. Other is the school education. Middle school education, some component are incorporated in the education sector, in the drug and alcohol also. Community mobilization is the most important things. And we have residential treatment and rehabilitation center. We are proud about the recovery people are, most of the 90% recovery people are running by the treatment and rehabilitation center. This is the more than 50% treatment and rehabilitation center are going very well, because all recovered addicts they are changed their life, and they want to change their other addicts' life. And also in the media awareness campaign is the most important things. Then we are doing also in the media campaign. And prescribing practice, just like the prescribing practice also in the sometime in the we are going to organize and training and workshop in the doctor also. Because without prescription, pharmacy also selling by the drugs, narcotic drugs and tranquilizer and stimulant drugs. Then we are also in the pharmacist and with coordination with the Department of Drug Administration, we are going to trading, but civil society is going to incorporate in connection with them. Prescribing drug monitoring. We have also in the sometime, we have also in the visiting in the monitoring team, civil society also in that team. The pharmacist shop is also in they are taking a prescription or not. Without prescription, they are selling or not. They are the monitoring process also involved in Nepal in the civil society. And other thing is the very important thing is the education for harm and risk reduction program. Only for educations, not only for the implementation of the issue. This is the most important about the thing because the prevention, treatment and rehabilitation is our mandate. The harm reduction education also most necessary for the awareness campaign and the educate for the other people. Then now is last year we are very requested for the Ministry of Home Affairs. Then now allocation of some budget. And now is starting with the evidence-based research programs, especially in the government sectors. Then family counseling, where now is starting the family counseling and social reintegration. Social reintegration is the very, very difficult issue in this our country. After detoxification, after treatment, and after rehabilitation, they go back to the society and home, and very difficult, again they are going to relapse. Then now we are just starting in the one districts, in the one rehabilitation center, in separate, the only for the social reintegration program. After discharge of the rehabilitation center, they are going to social reintegration minimum 1 week. They are going to invite in their ward people, politician people, and community people, and their family, then a counseling. And after that, we are going to discharge of them, adjustment for the society. That is also new program in Nepal. Then other thing is now is our police IGP is last year their initiation of the drug control by community police and civil society organization. Previously, the only for the police is going to campaign of the drug control and so many things in the community, but the community is not going to trust. Because the police is coming in my house, something is research, something is investigations, something is, they are deny of the civil society also. Then now is the NGO and civil society, we are jointly going to awareness campaign of the door-to-door. Then this is the initiation, national to local level, already circulated by the Ministry of Home Affairs and the police headquarters to community police and civil society is going to awareness campaign in this country. Thank you.
Thank you, Rishiraj. We've kind of covered all the probable barriers that we have in front of us in creating drug-free societies, and it's been interesting because all three of them kind of touched what should be done to create this. We had Dr. Musa Daud telling us how effectively civil societies should work with the government and be a link between the government and the community, and the recommendations he made towards that. And Dr. Sandeep was telling us the importance of paying attention to the hidden population and how they should be regarded as well. And we had Mr. Rishi telling us where the government should focus on prevention. Prevention should be the focus. There should be more priority given to the prevention work towards creating drug-free societies.